Kia ora team, my name's Ben and today we're going to do the anterior thigh and shin. So first of all, if we have a look at how the client's draped, so anything that we're not massaging is going to be covered with our draping, and the drape is tucked into his underwear or his shorts, and you get your client to tuck that in themselves so that they create the boundary of wherever they want to be massaged. The other thing is the draping then goes underneath the leg to form a nice tight seal so there's no gaping. Then we also have a towel or something underneath the knee just in case they have any tightness through the knee or tightness in the low back, just to take a bit of pressure off. Okay, and we begin with effleurage. So we'll begin at the shin. So effleurage, that nice gentle stroke, just introducing touch. And as you effleurage through the shin, you'll feel the tibial crest, the anterior crest running through here. So that's bone. We don't massage bone, we massage soft tissue. So most of what we're going to focus on is the lateral side where tibialis anterior is. So after effleurage, we begin our petrissage. So we double our hands over and apply pressure through the finger pads coming up. And we want to do strips so that we don't miss anything. And during this time we want to talk to our client just about the pressure and how much they want. And we're looking to feel different areas of tightness, tissue tension, and temperature. And through our petrissage, we'll then get an idea of what areas we may want to go back to and spend more time on. Following up with effleurage again. So a nice easy stroke. And then we can do some deep thumb stroking through tibialis anterior. So we can either use a single thumb coming up there, or we can piggyback the thumb to apply more pressure. And again, always checking with your client as to how much is comfortable or how much they want. And we can proceed on with our double thumb circles. And again, either following up in strips, or if there's a particular area that we've found that is tight or the client is concerned about, we can focus in on there. And we can return back to our effleurage. We can use the palm of our hand and line it up with tibialis anterior, lining our knuckles with the anterior crest to apply a deeper stroke running up laterally. And so our knuckles are just lining up the anterior shin, so there's no pressure there, all the pressure comes through the muscles of the lateral shin. Back to effleurage. And then we can drain the lower limb before moving up to the quads. So if you form a cuff and come up, draining up to the knee. Then we can proceed up to the thigh with our effleurage. So making sure we apply the lubricant over the entire thigh, and always be aware of wherever that draping is the boundary of where you palpate. After our effleurage, we move to our petrissage. So again, our fingertips, nice and slow and controlled, palpating the tissue and getting a sense for tissue tension, temperature, tightness. And it's always good to be systematic and follow along in strips so that we don't miss anything. And then getting back into effleurage. And deep thumb strokes. So using our thumbs to stroke up and being mindful of our client and checking what pressure they prefer. And then if there's any areas of tightness you want to spend more time on, we can do our double thumb strokes. And then back to effleurage. Just to give the client and yourself a break. And then we can do some deep stroking along VMO, or vastus medialis obliquus. Just following up from the kneecap and following VMO. Then, to access the adductors or the groin, we get our client to bend their knee up and then place their heel by their opposite knee and then relaxing their leg down. So depending on the flexibility of the client, either they can rest their leg on a towel, or if they're not quite as flexible, you may have to rest that on a higher pillow or their knee on your belly on the towel. Relaxing down. And from here we've got good access to his adductors. So effleuraging. And so this is where it's important that you've tucked the draping in securely and also tucked it underneath the leg so it's held into place. And then we can proceed with our petrissage through our adductors. And again with our thumb circles. And then we can do deeper strokes using the on the border of our forearm, and we can slowly come down. And again, talk to your client about the amount of pressure they want. So this can be quite sensitive, so we want to adjust our pressure to what your client desires. And then back to effleurage. So after a deep technique, we're going to go back to effleurage to give the tissue, yourself and your client a bit of a break. Alright, we can return the leg back to the original position, and in this position we can knead. So scooping, picking up the tissue, squeezing, and then dropping. So scoop and squeeze. So again, remember, we always want to have this position with our fingers, never this. So as much contact as possible and never pokey. And then back nice and light, effleurage. And also through the thigh, we can do ringing, which is just alternating the hands and sliding back and forth. Then just like we did in the shin, we can drain, so forming a cuff and coming up the thigh, making sure to finish your stroke laterally and away from the groin so we don't have any accidental mistakes. And then some gentle effleurage to finish. Before we re-drape them. And then just gently jostle to get rid of any extra cream. And we are done. Alright, good work team.